आज मैं आपको एक डॉक्टर एल्सवर्थ हेरमैन के जो रिनाउंड कार्डियोलॉजिस्ट थे 107 साल की उम्र में आज भी वो हेल्दी लाइफ जी रहे हैं। 95 ईयर्स तक उन्होंने प्रैक्टिस किया। उनका कहना है कि जो यूरोपियन कार्डियोलॉजी कांग्रेस और प्रिवेंटिव कार्डियोलॉजी कांग्रेस उनका भी ये कहना है कि if you want to prevent heart disease, you have to keep your cholesterol level below 140. And how it can be achieved? So first you have to avoid all milk products. But in India, we can use 200 ml of cow's milk per day with turmeric added, after removing cream on that milk. So avoid all milk products, saturated milk products. Then second is saturated food and fried food, that is animal products and fried foods and deeply fried foods. That becomes trans fatty acid rich food, and it is highly inflammatory and sticky and make blood clot faster. So avoid pizza, potato chips, burgers, or anything that is deeply fried, cutlets, that taste buds feel fine while eating, but it is very dangerous. Avoid cold drinks, that is liquid death. Sodas and cold drinks should be avoided. Avoid milk products, saturated milk products like lassi, ice cream, that is detrimental. Then totally restriction on sugar-based product. But in India, there is a trend that without sugar we cannot survive. So you have option that if you don't want to eat sugar, and you have to stop the sugar for the sake of the heart, for heart benefit, because sugar converts heart vessels in an inflammatory stage and makes you in such a state that your craving becomes more and more for sugar, because threshold of eating sugar doesn't identify. So you eat more and more and you become obese, and that is the main culprit of sugar. It leads to cardiometabolic syndrome. So instead of sugar, you can use sakar or brown jaggery. But don't use artificial sweeteners, that is cancerous. Then curtail on salt. We indulge salt very much while traveling. If we have anything to eat, we take packaging foods, and that foods if we see that it is fully loaded with cholesterol and sodium, highly sodium loaded. So per day sodium contents in eating goes about 10 gram. We should restrict it to below 2 gram. Then avoid smoking and all these stuffs, gutka, alcohol in India. Foreign people are not taking gutka, smoking, and this masala, but they take alcohol in winter, and they take in a restricted manner, 1 pack per day. but it should be restricted because it can lead to high triglyceride level. So at last, increase vegetable and fruits in your diet and wholesome grain, not polished grain. And at last, don't use processed oil, means refined oil. Don't use it because acetone is added in that process and it becomes rancid and highly inflammatory and sticky. Use cold press oil or filtered oil like olive oil, या mustard oil, या cottonseed oil, या sunflower oil, but it should not be refined or processed. That is very important. And after heart attack, if you go for the angiography and see multiple blockage I have in my heart arteries, and you become panic. So don't be panic. First test inflammatory markers test and heart muscle damage test and heart failure test. And then you decide that I should go on medical treatment because medical treatment as per ischemia trial is as equivalent to stent or bypass surgery. A lot of trials has done that medical treatment is better. But in emergency, you take emergency antiplatelet kit along with statin that I have mentioned in previous videos, and measure your BP and pulse and take control your BP below 120/80 and pulse 70, approximately 70. And if you have chest pain, sublingually solvitate every 5 minutes interval if BP is not below 90, systolic BP is not below 90. The emergency medicines, if you take, then your heart attack risk will be subsidized 50 to 70%. So medical treatment as per clinical trial is better. And then if your pumping is declined, if you have not taken any emergency medicines or not taken any antithrombotic injection in ACS, non-STEMI, or thrombolytics in STEMI, then your pumping will be declined and heart muscle becomes scared. Then you have to take enhanced external cardiac counterpulses, and that is US FDA approved or world FDA approved for heart failure, congestive heart failure treatment to improve pumping, improve exercise tolerance. No treatment like bypass or stent can do this. One company, ESMR, shockwave therapy, laser therapy, claim, but it is not FDA approved. It is investigational use. It doesn't show that how much time this effect persists, relief of angina or anything, how much time it can persist. While ECP has long-term effects, 7 to 8 years effects, if you maintain your lifestyle in a proper way, diet in a proper way, if you walk briskly or you cycle and you take proper sleep and become stressless. So overall, avoid dairy products, avoid refined processed oil, avoid sugary products, and take multiple fruits, vegetables, and wholesome grain, desi khana, and avoid saturated and trans fatty acid rich food that is either vegetarian or non-vegetarian. Avoid it. Thank you.